Hi there, and welcome to A&P with Dr. O. In our video here, we are going to take a further look at the anatomy of the scrotum, testes, and epididymis, and we are going to do so using another figure from the Anatomy and Physiology OpenStax book. What we're looking at here is we're looking at one testis. Here we can see one of the testes, and it has been cut open and the scrotal cavity has been cut open. That way we can see additional internal structures that we haven't talked about yet. The outer covering, this outer tough connective tissue, here, outside the testes, is the tunica. Albuginea. And what's going to happen is this tunica albuginea is going to move into the testis and form these walls or partitions between the seminiferous tubules that we see here. And when we're talking about a wall or partition, we use the term septa for plural. Septum would be singular or one of those partitions. Since we are pointing out more than one, we would use the plural form of septa. Again, these are going to be the partitions separating our seminiferous tubules. We can go ahead then and label those as well. Sperm is going to be produced within the seminiferous tubules, and then it needs to have a route to the epididymis here. Right here, we can see the epididymis. This structure right here. And the way that the sperm is going to get to the epididymis is it's first going to move through the reedy testis. And then it's going to move through these efferent ductules. Efferent or efferens means to bring out. We're bringing the sperm out of the seminiferous tubules, out of the testis, and bringing it out to the epididymis here. The sperm is then going to make its way into the vas deferens here. And then the vas deferens, along with blood vessels, nerves, lymphatic vessels, are going to bundle together to form the spermatic cord that we see here. And this spermatic cord is going to travel up and into the inguinal canal.